Once with detailed clinical history and examination, and after doing all the necessary imaging which is needed, once we've diagnosed the patient with patellofemoral pain syndrome, then comes the choice of treatment. Treatment could be conservative or surgical. Now, the conservative management of patellofemoral pain includes actually the management of pain itself. This could be like analgesics or painkillers which may be prescribed, along with the necessary augmentation of the muscles which is required. Adjustments of stressful activities is important. We must rule out what exactly is causing the pain. For example, in our case study, when she had danced over a period of time, she started having the pain. So what we can do is we can give analgesics along with initial to cut down the time. She was dancing about 18 hours a week. We can cut down initially so that actually there is less stressful activity for the knee, and once this pain settles down, she can continue to back to 18 hours a week again. Therefore, adjustments of stressful activities is very important. If the patient is having a pain with increasing climbing the stairs or coming down the stairs, then we need to adjust the lifestyle of the patient so that he or she does not actually continue to have an injury or problems which is pertaining to the knee joint pain. Then, along with the analgesics, we have to give focused physiotherapy. That is because these patients usually have weakness of quadriceps. Quadricep strengthening exercises are of prime importance, and focus is actually on the vastus medialis obliquus strengthening as well. These can be can have patients have these patients can have certain sessions with the physiotherapist, and then these patients can be taught exercises which they can continue at home as well, especially which is centered over the quadricep strengthening. And among the quadricep, the most important muscle is actually the vastus medialis obliquus muscle. Then exercises, as it's although helps to actually rejuvenate as well, and therefore these patients can be taught exactly what exercises they need to do, so that there is actually less and less strain on the knee joint. Therefore, it's important that you need to strengthen the muscles with open chain and long closed chain exercises. But what's important is, for example, if a patient is having a problem of anterior knee pain syndrome, and you cannot just ask them to jog a lot, because although jogging is an exercise, but that would actually aggravate their pain. Therefore, you need to make it sure you need to tailor your exercise programs and physiotherapy program according to the patient's need and patient's underlying problem, which is exactly the patient is facing. Then you may require certain orthopedic devices as well. If there is any malalignment, there is increased valgum, an external tibial torsion, an increased femoral anteversion, straight away initially going for the surgery, we can also go for certain orthotic devices which can be given so that to stop the progression of the deformity, and then later on we can correct this deformity by use some form of a surgery as well. Therefore, support of the valgus foot can also be given for the patients who have certain degree of malalignment, especially associated with miserable malalignment syndrome. Now, this is important to understand that treatment of anterior knee pain syndrome or patellofemoral pain syndrome initially is centered over the rehabilitation as well as to decrease the pain and symptoms of the patient. Along with analgesics, we do adjustment of the stressful activities. We make it sure that patient avoids those activities which actually increase the pain. Along with the focused physiotherapy and therapy is just more over the strengthening of the quadriceps. We exercise regimen is actually formed so that the patient can have closed chain and open chain exercises, so that its muscle gets strengthened but actually produces less strain on the knee joint. Along with may require sometimes the orthotic device as well. All these actually can help patient decrease in the intensity of the pain, get rid of the pain as well as the syndrome, and once the patient gets back normal, patient can actually after the rehab can continue his or her daily activities normally. And sometimes these are so successful that patient may not need any surgical correction altogether. But if these fail or if the patient continues to have a problem, then we may have to proceed towards the surgical treatment of the patellofemoral pain syndrome.